back. We are live with the Holistic Truth, otherwise known as the Jamie and Joe Show. What is the Jamie and Joe Show?
Do you think they remember? It's the longest running episodic duo healthy talk show on the air. Everywhere.
And the most entertaining.
Of course.
He's
3
back-
years,
he's
4
back,
years.
Phil. So we're live. I'm your host today, Jamie Dorley, with the co-host, the one and only Joe Messino. And in the back studio, we have Philly Phil on the board doing an incredible job. Thanks, Phil.
He's working 3 cameras. He's working the sound, the audio, everything. He does it all.
Hair and makeup. He's been there all morning with me, Joe, so we're getting there. But we are into November, and our focus this month is immunity.
Yeah.
Because it's getting into that season where the weather's changing.
Mm-hmm.
I mean, it's down to 70 degrees here in Pittsburgh. And we're quickly
yesterday.
approaching the holidays. Sugar season has begun.
Oh, yeah.
And people's immune systems are already going to be under attack.
Yes.
So we got to get ready, because the best time to get ready to get sick is before you get sick.
Exactly. We prefer you address your immune system health all year round. You know, don't wait for these seasons to hit. Do it all year, and when it hits, you won't even notice.
Yeah, we have a nice program, and I think the key is during these next few months, right, especially when you hit the holidays, is that you can't throw the towel in, Joe.
No.
You ever hear people do that?
Yes. Oh, it's the holiday season. I'm just going to, let it go, and then come January, I'll
Pick it up in
pick it up.
January.
Yeah.
Well, if you really look at the holiday season, right, regardless of what your culture is or religious preference, we all celebrate maybe about 10 days, right? There's about 10 days from Thanksgiving until New Year's that you are considered a holiday, right?
Unfortunately, most people will go from the day before Thanksgiving till New Year's, till the 2nd of January.
Well, we can't do that anymore. The old days of in the New Year just working out and eating good for a few weeks or a couple of months, they're over.
Yeah.
Because our bodies are under constant attack, right?
Right.
And the best way is to prevent it from happening. And we got some really unique formulations, and we got some great lifestyle therapies that can help you.
Absolutely.
And sometimes it's simple as looking at the foundations, right?
It is, and the beauty of these formulations is that they're so versatile. They can be taken all year round at a minimum dosage, and then if you do happen to get sick, you can bump it up therapeutically.
Well, we can look at the individual formulas for this month, and before we do, just want to give everyone a little wrap-up of where we were last week. So Joe was doing an incredible VIP dinner presentation, you and Dr. Len. So what was the topic?
You know what? It was Len and Joe revisited, But, yeah, it was the gut hormone connection. Oh, and I got to tell you, it was an amazing presentation. Dr. Len wrote most of it. I added a few things here and there. But, boy, he uncovered some amazing things relating to hormone replacement therapy, and the gut connection to that. It was really something.
So you guys did a great job in Akron, Ohio, which is right outside of Cleveland. I know we had a sold-out group of about 20 people, 25 people.
Yeah.
So it's always nice you guys did that. And the rest of our team, me, the future, the director of product development, my son, Zach Dorley, and, of course, the GOAT, Mikey Gallagher, DMG, was out there. And it was great that Mike and Zach joined me to go to the Supply Side West show. We got a nice opportunity to see a lot of our partners that supply these really unique ingredients that are really cutting edge.
Yeah, and I see Mike was on the job asking for white papers from everybody.
Absolutely.
Yeah, and some of them have been delivered already.
Yes. So we met with our partners. For example, our partners, we have at Gnosis, right, who provide for us the quadrifolate. And we didn't stop there with Gnosis.
No.
We have the Imodium, the patented glutathione. And we're able to look at some new ingredients that they have. In addition, we met with our team at Balchem, who actually owns Albion Minerals, and they got a new person on their team.
Oh, yeah?
The one and only Drake Kellis from
Drake.
San Diego, California.
Love the Drake.
Yep, he's right under the tutelage of Rick Harnish.
All right.
Bringing him under his wing. And it was nice to see some old friends and people we worked with in the industry, and then meet some new ones. And We met with OmniActive and looked at the curcumin and the Lutamax and a couple of new ingredients there. And there's actually a new ingredient that you and Dr. Len called me with.
Right from the car. And Dr. Len goes, well, I've been looking at this new ingredient. He goes, we're going to have to remember to tell Jamie. I said, remember what? Dialed you up right from there, and boy, you were right on.
Well, good thing you did. About an hour later, I found it, right?
That's right.
It's from one of our other partners at NutriScience that already have a couple ingredients like the sun-theanine, right, that we work with. Yeah. So it was nice that they actually had the ingredient right on their big board. Good. So just want to let everyone know we're out there hustling. We have our team out there in the field. 3 of us spent the week in Vegas. We had 3 more in Ohio. We have people in Atlanta, people in Florida, people in Pittsburgh, all working hard as we continue on our mission to make the world healthy.
Shout out to Freddie Como out in Ohio, because he got them there. He got that room filled, and he did a real nice intro as well.
Oh, he did.
Yeah, he's
great job, Freddie.
Stepping up.
And we're excited to be going down to Tampa this week. I'll be presenting with Dr. Len Bransowitz on a really interesting topic. He's going to really look at the journey from pharmaceutical to nutraceutical. And he's going to highlight about 10 conditions. I'm going to do the warm-up act. And our host is going to be Jay Lakeen. So I'm excited what she has to say. And she's going to fill the room this week. And we're really excited to go to my home away from home, Tampa, Florida. So, Joe, let's get into immunity solutions, right? We know that the best way is prevention.
Yeah.
There's so much research out there. And based on the research, a couple of years ago, we put together the Immune Kit.
The Immune Kit. Why not put it all in one, make it simple and easy for everybody without having to make any decisions? And the foundation, as we always start with the foundation, is Immunomax. This formula, been a standard for us for a long, long time.
And we did meet one of our partners from Mushroom Wisdom, right? And they have a key ingredient is called the PD fraction of the maitake mushroom extract, which is interesting because Mike had explained what the PD fraction meant to the guy at the booth.
Oh, did?
Yes. And the guy's answer was, thank you. I never knew that. I always wondered what that meant.
Oh, boy.
So the point is that our team has a lot of passion, lot of knowledge, and a lot of enthusiasm to really learn these ingredients, because the Immunomax is not a single ingredient.
No.
We have things like DMG, arabinogalacticans in there. They're not only the beta-1, but the beta-6 glucan. Why both?
Because you're going to get different probiotic activity from each one of those beta-glucans, and they're food-based, and there's no sense in just having one. We like to have the family of nutrients for that whole synergy.
Yeah, and the nice thing with beta-1 and 3-glucan is that they both work differently. Think about it this way. They sit on top of the receptor sites, right? And when viruses and bacteria come by, some bind better to the 1,3-glucan, some to the 1,6-glucan. Think about a parking spot, right? Some have the compact cars, some have regular cars, and you need a bigger one for a truck. Same way on the receptor sites. The viruses and bacteria and molds and funguses that are floating through the blood don't always attach to every receptor.
That's right.
So the nice thing with having both in there is that they are able to engulf different types of species that we're exposed to on an everyday basis.
That's an important point, and we're going to come back to that a little while later in this presentation, because there's some other receptor site issues that we have to take care of.
So the Immunomax has all in one. It comes in a capsule or chewable. I prefer the capsule. How about yourself?
So do I. I prefer the chewable, actually.
Oh, okay.
Yeah, I thought you were going to say chewable. But yeah, I definitely like the chewable. The capsule, though, is the one that's going to be the best to take with you for travel. If you're moving around, traveling around the country, travel's great.
So again, we have options. The Immune Kit itself does have the capsule version in it.
Right.
If you want to get them a la carte, we have the chewable. So we didn't stop there. Another key nutrient, as we know, is D3.
Yeah.
And vitamin D3 is interesting because we've been talking about this for a long time. We're at a seminar recently with Dr. Richard Silva, and the topic was diabetes, and he said D3 is not a vitamin; it's a
hormone. Yes, it's a non-steroidal regulatory hormone in the body. And that means, folks, that whole argument of be careful, it's fat-soluble vitamin, you can take too much. No, I'm sorry. We're not going to be able to take too much.
No, it's one of those things where you got to look at the scores, right?
Mhm.
If you get your blood work done, you should get it done at least once a year. Get your D3 levels tested.
Definitely.
It could be on the same blood work they're doing already. You just got to check
Sure.
that one more box.
25 hydroxy D is the test.
Yeah, so the challenge, Joe, is if you look at the scores, the range is from 30 to 100.
Right.
Think back in high school, right? Me and you were getting hundreds.
Yeah, I never got a 30 on anything.
A 30 would be a what?
It'd be below failing.
Yeah.
You didn't show up.
Incomplete. Yeah, I think 65 or 70 was
Yeah.
passing, right?
Yeah.
So same thing with vitamin D3. You need at least 70 to pass the test.
Right.
30, 35, 40, it is low
Mm-hmm.
optimal. And therapeutic really gets around 70 or 80.
Exactly.
And we haven't seen anybody with D3 toxicity.
No,
Okay, it may happen. Chances are it's not going to happen.
it's not going to happen.
And you can look at it as it's not going to happen to you.
Right.
So get your blood work tested every year, and you'll be able to be on
We
top
call
of
it the alpha nutrient because it's the only nutrient we get from the sun.
And people need anywhere between 1,000, more than likely 5,000 to 10,000
Yes, 5
of
to
this
10.
on a daily basis. So you can take it as part of our fish oil with the omega 3D. We have it in a capsule. We have it in a liquid. We have it in the kit. So many different ways of getting D3. Just make sure you get enough of it.
Yes, on a regular basis, all year round.
So
I love the next one, though. Buffered C. Why? Vitamin C. That was the original, right, James? The original flu fighter. Everybody took vitamin C for that.
absolutely. Vitamin C is so important. There's been studies going all the way back to Linus Pauling where we're doing 30 to 40,000
That's right.
milligrams of vitamin C per day. My mentor, Dr. Jeff Bland, was working with the Linus Pauling Institute on vitamin C studies, and they found is that you can go really high therapeutically with this,
Yes.
and tremendous amount of research for vitamin C for so many different things, but often looked at for colds and flus.
Yeah.
Not so much never going to have one, but if you do,
Mm-hmm.
the intensity is much lower and the duration is much shorter.
Absolutely. I mean, even if you go to, like you mentioned, Linus Pauling, Matthias Rath, these guys were the fathers and grandfathers of vitamin C. And you know what? It's so important, Jamie, because we don't make it. We're one of the few creatures on the planet that doesn't make it or synthesize it, so we have to actually intake it.
So how much do you take?
Well, with vitamin C, a good starting point's about 1,000 a day. Yeah.
So you can get 500 either from a capsule, you can get 2 caps, you can get it in your multivitamin, you get it
Sure.
from food. You know, so a lot of different ways to get it
Definitely.
other than just a supplement, but you want to get a combination from multiple sources, right? And of course, one of the best formulas that we've brought out, especially in the last couple of years with everything going on with the lungs and the immune system, but really cooling down the whole cytokine storm is quercetin.
Right.
So let's hear about quercetin.
Quercetin, an amazing bioflavonoid. And, you know, we've been using it for a long time because it is the most powerful natural antihistamine available to us. And in a lot of studies, we'll see it a little bit later, it outperforms even pharmaceuticals on inflammation.
Well, that's the part we love to hear, Joe, because, you know, we look at these ingredients, right? Then we look at the formulas, then look at the synergy together.
Right.
And that's why we put the immune kit, folks, because is there benefits for vitamin C? Of course.
Oh, yeah.
Is there
outside of it,
benefits for
sure.
D3? Yes. Quercetin,
Absolutely.
absolutely. When you start putting these together, the nice thing is now is we take all the guesswork out of it because we add in the Super Zinc 50, which is 50 milligrams of zinc in one capsule.
Right, in one capsule. And the beauty of that is zinc, we know, has always been involved in the healing process of the body. You know, we use it in combination with L-carnosine in a lot of our formulas. But it also has that ability to, once that virus or bacteria kind of gets in your system, it stops it in its tracks, stops it from replicating.
Exactly. So we put all these together. A great way to take the immune kit is how about one a day of each?
One a day of each for prevention. Absolutely.
What's your first sign or symptom when you're getting sick?
With me, it's usually a little tickle in the back of the throat.
For me, it's the back aches and change in temperature.
Yeah.
You know, I get hot, I get cold. So when that starts, then it's time to increase the dose. So you can go up to 2 a day, 4 a day, 6 a day of these is fine.
Absolutely, yes.
I like a nice 4 dose a day of all those for about 2 weeks.
That's what we usually say. Take one for prevention, 4 for therapeutic reasons.
So 1 to 4 per day of each of these formulas, and
A little more
look at
detail.
the power of just the Immunomax.
Yeah, look at this. I mean, you have the arabinogalactans, as you said. And, Jamie, you know why that's so important in there? They're actually prebiotics.
Yeah, they've been proven to double the number of immune cells in your intestinal tract. So why are all the immune cells jammed up around the intestinal tract?
Well, they're there to help fight off any incoming virus. And this is where your immune system, that's like ground zero for your immune system. And then, of course, DMG. Wow. If we couldn't do a formulation like this without DMG. DMG, dimethylglycine, we know is an adaptogen for the immune system. If you need different things, if you need killer cell activity, macrophage activity, your body's natural interferon, it will help the production of that in the body.
Absolutely. And there's actually a U.S. patent for modulating the immune system of the treatment of inflammatory disease and autoimmune condition, RA. So that ingredient by itself has been proven to help and has a U.S. patent. Olive leaf extract, excellent for anti-candida.
One of the originals, right?
antibacterial.
Been around a long time.
We talked about the beta-136 glucan, and of course the maitake PD fraction, which all the research on mushroom and maitake is actually on this PD fraction.
That's right.
Which is a very delicate fraction of the mushroom extract.
And that's important because it's the lowest molecular weight of this ingredient available. And that means your body will assimilate it.
Well, that's a great point, Joe. So we're talking here about immunity in the month of November. I'm your host, Jamie Dorley, my co-host, Joe Messino. This is The Holistic Truth. You can catch us every week. We go live at 12 o'clock noon on Mondays.
That's right. High noon.
And the great thing is that we go through each week. We're going to talk more about the categories, and we're going to fill you in with the latest and greatest research. And most importantly, what are some clinical pearls we can share with you, right, Joe?
Yeah, absolutely. Because those are usually coming from real-life incidences, people that are actually getting the results. That's important.
Let's talk a little more about vitamin D.
Yeah.
There was a great study actually released in PubMed.
Yeah.
That was April of 2020, right when COVID was hitting. And it talked about utilizing different dosages, right? It was really cool because it used to be that people were concerned with over 400 IUs.
Yeah, right.
Then it went 1,000. Then we went to 5,000. They're saying now you can go up to 10, 20, or 30,000 for at least 3 weeks or until you get your levels up to 60.
Yes, exactly. And the minimum should be 10,000 IUs daily.
Yeah, there's been studies at UCLA where they did 100,000 IUs over a course of 3 days to get an acute response.
Right.
And they found it's just as effective without any side effects as antibiotics.
That's huge. I mean, think about that. No side effects, no adverse effects. And in the meantime, you're getting a nutrient that you absolutely need for so many other reasons in your body.
So I love it. Vitamin D3 has got to be a staple of everyone's program. We've bumped it up in our fish oil. We've added to our multis. You have it in the immune kit. There's no reason why you shouldn't get enough vitamin D.
No, there's no reason. And as we were talking earlier about receptor sites, Jamie, vitamin D3 will occupy the same receptor site an invading virus or bacteria would attach to. So if it's already occupied like that parking space, then the other one can't attach.
Well, that's a fantastic clinical pearl, Joe, because, if on the flip side, if you don't have these spaces occupied.
Yeah, they're vulnerable.
Happens?
They're vulnerable to be overcome. That's right.
So you need a good defense, folks, and vitamin D is one of the key players in your defense. It's like the middle linebacker of your defense.
Exactly. Yeah, it's got to be there. There'll be a big hole if it's not. And then we talk about, the benefits, right? The PSEs, the positive side effects, it helps with the production of nitric oxide. And we know how important that is for the endothelial lining, especially nasal and respiratory passages.
Oh, I love it. What a great formulation. This is part of the immune kit. And, a good dose for anybody is going to be about 5,000 a day.
Start with 5.
And again, get those levels tested. They're already getting the blood work. All they need to do is check the box, folks. And remember, the range is 30 to 100. However, therapeutic is over 60. We like 70 to 80 would be great.
Right. We want to be up there in that B plus range at
So
least.
when you look at vitamin C's on the market, they're mostly derived actually from corn, but at Nutritional Frontiers, we decided to go a different route. The Buffered C Plus is actually from acerola, from cherry extract, because some people may have a corn allergen, right? So we don't use any corn-derived vitamin C in the Buffered C Plus. It doesn't mean that those vitamin C's would hurt you, right? It's been utilized for years that way.
Sure.
However, on this formula by itself, we wanted to get a different extract.
Different extract. And a lot of, corn along with wheat and soy are highly genetically modified. So this gives you an alternative to that. But, Buffered C it acts like, this is the thing that want to keep in mind, where you occupy a receptor site, don't let it in. Or with zinc, you prevent it from replicating. With vitamin C, this is why it was the original flu fighter, because it would just attack these cells, right? Attack these flu cells and receptors like heat-seeking missiles. So these are your highly trained soldiers going after the virus.
You can bump the vitamin C up usually to bowel tolerance.
Yes.
I find that most people do better on the buffered version of it. But either way, you can go up sometimes 3, 4, 5 grams.
Yeah.
Spread it out during the day, right? Don't take it all at once. It may flush your system out.
And your body will tell you when you've had enough.
Which is another benefit of Buffered C. I know Dr. Len does a vitamin C flush quite a bit.
Yes, he does.
That he talks about to get rid of toxins and to clear out the intestinal tract. So you can use anywhere between 500 to 5,000.
Yeah.
And some people may even go higher.
Exactly. A good minimum dose would be 500 to 1,000 a day. You get sick, you're going to immediately get that up to 2,000, 4, and 5, like you said, until you get that bowel tolerance and your body's going to say, that's enough, we'll work with this. Bioflavonoids, again, never just one, right? You got to add a little bit extra in there. And bioflavonoids have been shown to actually extend the life of the vitamin C, help it work a little bit longer.
Yeah, it's really important to have these formulations that have more synergy to them. And that's the whole idea of the kit. Right?
Yeah, the whole kit is synergistic.
We're eliminating the guesswork.
Yes.
We've put this together with all the science. So you're getting a well-rounded defense. You're getting the right dosages in without any doses that are too high or too low. Yes, and you're getting a therapeutic effect. And quercetin is one of the things we added to it because, like you said earlier, it's outperformed some medications for its anti-inflammatory effects. So you want to comment on that?
Yeah, the drug was called Chromalin, and it was studied on a 1-to-1 basis on anti-inflammatory action, and it outperformed it every single time at a high rate. And then guess what? No adverse effects except positive ones.
Yeah, and you can take a higher dose on this one again to get that anti-inflammatory effect that works really good on allergies. Right.
Yeah, that's why it's a cornerstone of our Air Max formulation.
Oh, absolutely. So quercetin, vitamin D3, Buffered C Plus, Immunomax, and then we have Super Zinc 50, which you need the dose, folks. You need a good dose of zinc on a daily basis.
It's a very essential
now,
mineral.
You can go as high as 200 for about 2 weeks.
Yes.
So again, that's 4
on a limited basis, right?
Yeah. But you don't need any more than that.
Not at all. And then you can do it on a preventative basis, taking a capsule every day or every other day. It just, as long as you're getting it into your body.
Yeah, and this was really common and popular during the whole COVID peak.
Yes.
Because they were talking about it, showing that it inhibits the replication of the virus, right? Yeah. So, some of the things like D3 are going to block the absorbability. Vitamin C is going to help kill it off. And then zinc's going to prevent the replication of the virus. So you have a multiple faceted.
You have a trifecta.
There we go, right?
Yeah, the trifecta.
So you have many different mechanisms of action because that's how the body works, Joe.
Exactly. Never one thing. And then for good measure, you might want to add in a little N-acetylcysteine. Now, this is one of those nutrients, folks, very, very common nutrient over the years. It's an amino acid. It's necessary for your body to produce glutathione because, you can't, we do have Imothian now, but before you couldn't get it in a good bioavailable form. So you had to help your body make it. Vitamin C, NAC,
Yeah, DMG,
they work together.
They all feed the production, right? They're all precursors to glutathione.
Exactly.
And they all have their own roles, especially
Yes.
with NAC,
And the
with
lungs.
the mucus in the lungs,
Yeah.
right? Liver protection, breathing, right? Those bronchial tubes are able to actually open up. They get covered in a mucus, so they can't really expand to get that deep breath, to get the oxygen capacity saturated. So something like NAC can be very therapeutic,
Yeah.
especially with lungs and allergies. And, at one point, NAC was actually an OTC.
Yeah.
right?
Yeah. And then there are studies out there, and we have a bunch of them that show that the people that had the most severe reactions to this virus were the ones that had the lowest amount of glutathione in their body.
Well, that
So,
explains a lot, doesn't it?
sure does.
The people that were highest risk had highest issues.
Exactly. Yep. Yeah, so that's our immune kit, our foundation for the month of November. Get started now. Boost your immune system, and then if anything hits, you'll be more equipped to handle it.
So what about if you have a younger, maybe a kid? What would you recommend dosing wise for them?
Well, minimum dosing is still fine for kids. Because why? Because these are all natural, safe supplements and formulations. So minimum dosage for kids, 500 milligrams vitamin C. Yeah, maybe 5,000, 2 to 5,000 of D3. If you have kids and they'd rather chew, get them the Immunomax chewables. One a day is all it would take for
So we
them.
have Immunomax chewables. We have the D3 in a liquid. We have vitamin C in chewables.
That's right. Cherry chews.
So you have
yeah.
other options there. Plus, a lot of my clients have been texting me saying that they've been utilizing the Power Cleansing Greens for kids, even at half a scoop of each.
Sure, and
Right.
DMG liquids and chewables. Let them get that. I've had our practitioners give DMG liquid to infants, and it's effective and safe.
Yeah, I think that was one of the first formulas Dr. Tracy Straub used.
That's right.
Well, she had a really sick infant,
Yeah.
and Mike recommended it, and she said, "Are you sure?" And she did recommend that the person took the liquid. She said within 48 hours, the kid had incredible turnaround.
Yeah, big
right?
turnaround. DMG
So
is that good.
very safe and very effective.
Exactly.
And I want to talk about a couple of things lifestyle related,
Mm.
Joe, because the immune system works much better when it's fed well.
That's
right?
right.
And that's mind, body, and spirit. So we got unseasonably warm weathers right now. Take advantage of it.
Yeah.
But even if it's a little crisp in the morning, put on the hoodie.
Yeah.
Put on the extra clothing and layers so that you can get out there, because the body likes fresh air and it likes to move. So I think what's happening is now people aren't spending enough time outside.
Everything's inside and on a chair.
Yeah.
Yeah.
So you got to move around, folks. You gotta
But
get
not
your
our
steps.
director. He's standing over there. He's not sitting. That boy fell.
Well, I think there's other factors involved. I was just talking to my family about this yesterday. I said, I traveled so much last week, and it's really sad to me the amount of time people are on their phones.
I know.
So I got to be very conscious of it, right?
Yeah.
Because it's so easy. I said it's like TV.
Yeah.
If you're going to watch a game, it's one thing, but don't just watch TV, right? You're going to watch Seinfeld, that's fine. You're going to watch a movie, documentary, no problem. Don't just sit there and mindlessly look at the TV. And the same with the phone. And, Joe, it's to the point now where people are walking through the airport on the phone.
I know. Without looking up.
Yes.
Yeah. They're walking like this. I know.
So be careful of it. Be conscious of it. Take a technology break, right? If it's that important, you can get back to the person. And I know it's required for work. I'm talking about when you're just on there flipping through and just it's like a mental pacifier, right?
Yeah, exactly. And Jamie, how many times I know we're on the phone and I know you're walking. I can hear that you're walking. You're outside walking, and you can do this if you need to be on the phone. And I prefer using a wired headset, so that you're not taking in a whole lot of that radiation. But walk and talk.
Oh, I don't mind someone, talking on the phone and walking. I'm talking about buzzing around, looking down, and playing around on social media or something.
Yeah.
So, the other things are grounding, right?
Yes.
Earthing, right? I just read another article on that, talk about the importance of electromagnetic energy, right? say whatever you want, whatever level you're at, but do you feel better walking on the beach?
Oh,
Are your shoes
yes.
on or off?
They got to be off. You connect with that sand and water, and that there's nothing better for getting the Earth's energy.
Right,
Nothing
and then
better.
you can do things like praying and meditating.
Right.
There's so many advantages of using a phone now in a positive way.
Right.
So I got a couple of really cool apps. One's called I Am.
Mm.
It's a positive reinforcement, and the other one's motivational, right? And I got this other one now called Synchronicity, where it actually is it plays good
Solfeggio frequencies.
frequencies.
Yes.
Yeah, there you go. So that's a good thing to start your day with or end your day with.
Yes.
So you can use technology to help leverage some of these tools. However, you don't need to be on there aimlessly every minute of every day.
No.
In addition, having good conversations and laughing, exercise, eating well, water, these are all ways to help build your immune system and build your body so it's stronger. Don't work out because you're guilty of eating something bad. Work out to make your body stronger.
Exactly. And don't worry about getting sick. Because you know what worrying is, Jamie?
No.
It's using your imagination to create something you don't want.
Oh, well, there you go. Well, I'm not worried about
Joeism.
anything right now, Joe. Thank you.
Good.
So there's a lot of things you can do. We have a great lifestyle booklet called NF for Life. Right on our new website, you go to nutritionalfrontiers.com. You can get a free copy of the book, right?
Yep.
And there's a lot of great things you can use in there as really like a handbook overall. Take advantage of the immune specials throughout the month, right? We're all having these all on discounts throughout the month. No minimums required.
And you can get the nutrients, the formulations individually if you like as well.
Sure, a la carte, right?
Yeah.
So you don't got to buy the kit. Some people
Sure.
love the kit. A lot of our healthcare professionals love it because the patients just say, what do I need to do? Take one a day of each.
That's it.
If you want to go a la carte or you have a special patient populations such as kids or elderly that can't swallow, you want something liquid or chewable, we have those options for you too.
Absolutely. Whatever you need, we have an option for it, right? Especially for the whole family.
Yeah, and if you're a healthcare professional and you have some questions about a specific patient, you can always email us at Nutritional Frontiers, right through the website, info@nutritionalfrontiers.com. And we got a lot of great events coming up. We have of course, the VIP dinner this week in Tampa and VIP dinner next week in Atlanta. That's really looking at the patient's journey from pharmaceutical to nutraceutical with Dr. Len Bransowitz. And then we have our VIP dinner Thursday, December 1st, right here in Pittsburgh, PA.
Yeah, do you see
That's
the
gonna
list filling up?
Is it filling up?
Oh, yeah.
That's going to be
Gonna
a
big
fun
one.
event. We're going to look at a year in review, right? So it's going to be more of an entertaining night and a party, but we're going to have a good time. And then we didn't stop there, Joe.
Oh, boy.
Right around the corner, February 10th and 11th, in beautiful Sand Key, Florida, right outside of Clearwater, we have Wellness Weekend, how to practice what you preach at the beach. So we're going to have great workshops. We have Dr. Bob Rakowski there. Pauline is going to be speaking. Dr. Tracy will be down. We have an incredible lineup that weekend.
Yeah.
And we're going to do some book signing with Dr. Judy. So it's going to be a great weekend to really break bread together, enjoy each other, network, right? Learn from each other, come together, get some good free time. We do some beach walks and some yoga.
Great
So
energy.
really nice event. So go to nutritionalfrontiers.com. You can email us for any further details on any of the events. And we're bringing events to your neighborhood. And then we have 2 big events a year that you can travel to.
And let's not forget the 100th edition of the James Weiner Wellness Week, coming up December 3rd.
Weiner Wellness Week 100, Joe.
100.
Can you believe it?
Centennial. Look out.
So this is December 3rd through the 10th at the World of Wellness. You can participate live throughout that week, or you can
Come on
participate
down.
through Zoom.
Sure.
But we want you to come in because we have special $100 care packages for anybody who attends, plus free food, workshops,
Nice.
smoothies, treats, literature, books, so many different things just by attending that event.
It's going to be a great event. It's at a perfect time of the year for it. It just so happens it landed on the holiday edition of the Wellness Week, right?
There you
No
go.
mistakes.
No, number 100. And we're going to be celebrating, of course, the late, great international icon, Dr. James Weiner,
Yep.
who really started these events with us way back when. And here we are, Weiner Wellness Week 100, Joe.
Wow.
Can't believe
Yeah,
it.
me either. It's going to be a blast. Looking forward to it.
Well, thanks so much. You did an incredible job last week
Thank
in
you.
Ohio.
Appreciate it.
We love all support you're giving to our team and our healthcare professionals. I know you're heading to Atlanta this
Heading
week.
down to Hotlanta this week. Yep.
Help me, Rhonda.
Help me, Rhonda. Look out.
So we got Joe down there. I'm going to be in Tampa. And look forward to seeing everyone at our next event. Tune in every Monday at 12 noon for our weekly edition of The Holistic Truth, otherwise known as the Jamie and Joe Show.
Absolutely. We're back. We're better than ever. We want to see you here.
Have a great day, and God bless.